Why is the optic nerve-brain connection important in optic neuritis? Imagine your eyes as cameras sending images to your brain for interpretation. The optic nerve acts like a cable that carries these visual signals from your eye to your brain. In optic neuritis, this cable becomes inflamed or damaged, which can cause serious problems with how you see. The connection between the optic nerve and the brain is essential because it allows your brain to receive clear, accurate visual information. If this connection is disrupted, your brain might get incomplete or distorted images, leading to vision loss or visual disturbances. The optic nerve is made up of about 1.2 million tiny nerve fibers called retinal ganglion cell axons. These fibers gather at the back of in an area called the optic disc, and then exit the eye from the nerve. This nerve travels through a small opening in the skull called the optic canal and connects directly to parts of the brain involved in processing what you see. It carries all kinds of visual data, including how bright things are, colors, and contrast. This information is sent to a part of the brain called the lateral geniculate nucleus and then to the visual cortex in the occipital lobe, where your brain turns these signals into the images you recognize. In cases of optic neuritis, the inflammation damages the nerve fibers and their protective covering called myelin. This damage slows down or blocks the electrical signals traveling from to your brain. As a result, you might experience blurred vision, difficulty seeing colors vividly, pain when moving your eye, or blind spots in your field of view. Because the optic nerve is part of your central nervous system, any inflammation can affect how well your brain receives and interprets visual signals. The connection between the optic nerve and the brain also helps control reflexes like the pupillary light reflex, which makes your pupils contract in bright light, and the accommodation reflex, which helps focus your eyes. When this connection is compromised, these reflexes may not work properly, affecting your overall visual function. Additionally, because the nerve fibers cross at a point called the optic chiasm, damage can impact how each eye's visual field is processed, which can affect depth perception and binocular vision. Understanding how the optic nerve connects to the brain is vital for diagnosing optic neuritis and understanding its effects. It also guides doctors in choosing treatments aimed at reducing inflammation and protecting nerve function. Protecting this connection is crucial because it is the main pathway that allows your eyes and brain to work together seamlessly. When this pathway is damaged, it can lead to lasting visual problems, so early diagnosis and proper care are essential to preserve your sight and neurological health. Always consult a healthcare professional if you experience sudden vision changes or eye pain, as they can provide personalized advice based on your specific situation.